Welcome everybody. My name is Jim Phillips. I'm Executive Director for the Centre for Empowering People and Communities, which is hosting this webinar, which is one of a series that we've been running. Previous webinars are available as recordings. This webinar is also part of SelfCare Week Europe. Some of you might be aware that we're fifth day of SelfCare Week, which has been running across the UK and across Europe, a whole number of different partners. Please go on to one of our partners, SelfCare Initiative Europe, their website. They've got loads of really good resources on self-care. Very apt at the moment around things like washing hands and the need for much increase around hygiene and everything, but each day has had a particular topic. There's great resources from a range of partners involved in that, so please have a look. We're very pleased to be part of the Self-Care Initiative Europe initiative, which has been running for a few years, and to be a partner in Self-Care Week. So please have a look at their resources. There's some fantastic stuff there. The agenda for today. So I'm very pleased to welcome Jonathan Berry, who's going to look at shared decision making, what it is, and a little bit around his implementation and the background to it and everything. And then we're going to have a conversation between David and Kath, really sort of talking about this from the patient's perspective and their experience of healthcare services over the years and the different perspectives, and how they feel from that viewpoint around shared decision making and its importance. And then we're going to be joined by one of our Danish colleagues, Nikolai Holm-Faber, who's going to be looking at a couple of projects around patients' perspective, looking at communication in consultations, and a whole piece of research which looks at what people think they've heard or think they've said and what's actually happened. Some really interesting work there. Who are we? So a little bit about us. We're a not-for-profit network. We're funded by the Robert Bosch Stiftung, which is a organization based in Germany who provides sort of grants to support the spread of empowerment approaches and looking at issues around social mobility, etc., across Europe. We're really grateful for their funding, which means that we were able to provide this and our other resources completely free of charge and without restriction. We're also supported by our host organization, the European Health Futures Forum, which is a collective of thinkers and people with a huge amount of experience. So we're delighted to be so supported. We didn't spring out of nowhere. We grew out of a network on patient empowerment, which was set up by a loose network of collaborating organizations across Europe with a focus on approaches that enable self-management and patient and community empowerment. A number of us came together to set up an OP, and then through that we put it onto a more formal footing to set up the CEmPaC. Key objective really is around identifying best practice and looking at how we can share best practice across Europe, support each other, share expertise, share materials, share the learning, and learn from each other's mistakes. So we're a very open, fluid network of people who share a common interest in seeing this shift in healthcare happening. What we're trying to do here is very much around improving health literacy, improving care. And our fundamental belief around this is around ensuring that the people using health and social care services are empowered to use them, are able to work in partnership with health and care professionals, and a real shift away from being told what's wrong with you, what's a fix-it approach, to being valued as an active partner, to have conversations and discussions around our health and well-being, which centered around what's important to us and as an individual. How can the health and care system support you to live the life that you want to live based around your values and what's important to you? as opposed to what is seen as needed fixing. And this involves a whole number of things around it. It involves people having the confidence, knowledge, and skills to engage in that way, or having high health literacy, but also healthcare professionals who can respond and participate and feel confident in having those conversations as well. Some of our previous webinars are very much focused on the community element of this and the self-management element. Our next two webinars, including this one, are focusing on some of the specific tools for healthcare professionals and care professionals to support this. And our webinar in January will really focus on the actual sort of underlying skills, health coaching skills, the health literacy skills to support that. I know Jonathan's going to touch on this, but embedding approaches that promote health literacy and person-centered care. This actually requires quite complex system change, and we talk about three core components we need to address. A supportive system, so a health and social care system which actually supports this way of working and is open to it and has IT systems and infrastructure which supports it. But also, as we just mentioned, that people have the confidence, knowledge, and skills and are feeling prepared and supported to work in this way. And also that teams of healthcare professionals within clinical pathways also have the resources and the tools to work in this way. And our range of resources as SelfCare and our webinar series are all designed to support each of these components. And things like our coffee break e-learning, our patient skills program, all support this and are free to access. I wanted to just finish with one slide before I hand over to Jonathan, and that's why focus on shared decision making. These are some stats from a GP survey carried out in England. When people are actually asked, nearly 40% of people weren't as involved as they wanted to be in making decisions about their healthcare and their treatments and their treatment options. And nearly 60% felt they didn't have enough support to manage their condition. So this really indicates that we need a real strong focus on supporting our health and social care staff to have the skills and the tools to be able to work in this way, because it's quite clear that this is how the public in a modern healthcare system expect to be treated and expect to be supported. And we'll hear more about that from David, Kath and David a little bit later.